Assalamualaikum warahmatullahi wabarakatuh. Introduced us from group 11, which consists of 4 people. The first is myself, Gania Hana, then there is Afifa Wahyuni, Sinta Octavia, and the last Yora Dwi Safni. Okay, let's explain about HIV. Starting from the definition, causes, signs and symptoms, maintenance, which consists of medical and non-medical treatments, and finally prevention. Well, first I will explain the definition of HIV. Human immunodeficiency virus, or HIV, is a type of virus that infects white blood cells, which causes a decrease in the human immune system. Acquired immune deficiency syndrome, or AIDS, is a collection of symptoms that arise due to decreased immunity caused by HIV infection. Okay, the next material is about causes, which will be explained by Yora Dwi Safni. Thank you.
Thank you, Hannah. The next is material is cause HIV. HIV transmission occurs with blood, sperm, or vaginal fluid from a infected person enter another person's body. This can happen in the number of ways, including 1. Sex. HIV injection can occur through sexual intercourse, either through of the vagina or rectum or anal. Although further, HIV can also be transmission through oral sex. However, transmission through oral sex will be only occur if there are open sores in the patient's mouth, sex, bleeding, gum, or canker sores. 2. Sharing needles. Sharing the use of surrogates with people with HIV is one way. Then can be someone injection with HIV. For example, using shared needles when make status or when using injecting drug. 3. Blood infection. HIV in transmission can occur when a person receives a blood donation from an HIV patient. Next material will be explained by Afifa.
Okay, thank you, Yora. Here, I will explain signs and symptoms of HIV. Here are the signs and symptoms of HIV. 1. Individual with HIV rarely feel and show signs and symptoms of infection. If there are symptoms that arise usually like the common cold, red patches on the skin, itches, rashes, and sore throats. 2. If the immune system decreases due to infection, other signs and symptoms will appear, such as swollen lymph nodes, weight loss, fever, diarrhea, and cough. In addition, there are also signs and symptoms that arise, namely nausea, vomiting, and cancer sores. 3. When the patient enters the chronic state, typical and more severe symptoms will appear. Symptoms that appear include cancer sores, vaginal discharge in the mouth, symptoms of herpes zoster, dandruff, severe vaginal discharge, and psychological disorders. Other symptoms that appear are not being able to eat, candidiasis, and cervical cancer. 4. In the advanced state, people with HIV will lose weight. The number of virus continues to increase. The number of CD4 plus lymphocytes decreases to less 200 cells all. In this case, AIDS is declared. 5. In the late stage, involve the development of opportunistic infections such as meningitis, Mycobacterium avium, and a decrease in the immune system. If not treated, there will be development of serious diseases such as tuberculosis, cryptococcal meningitis, cancer such as lymphoma, and Kaposi sarcoma. Okay, that's all from me. Thank you. Next material will be explained by Hannah.
Thank you, Afifa. Medical treatment. Antiretroviral therapy, or ERT, is the treatment of HIV infection with several drugs because HIV is a retrovirus. These drugs are commonly referred to as antiretroviral drugs or ARVs. The drugs used are 1. Epivirans is an oral drug in the form of capsules that serve to prevent the HIV virus from multiplying in the body. 2. Nevirapine is a drug used in the treatment of HIV infection. It works by reducing the amount of the HIV virus so that the immune system can work better. Thank you.
Non-medical treatment number 1, aloe vera juice. Study in Nigeria published in the Journal of Complementary and Integrative Medicine said that aloe vera has potential as a natural remedy in the treatment of HIV and AIDS because aloe vera juice drink also appear to have an increase in their healthy step. Aloe vera, number 1, peel and separate aloe vera from the skin, then cut and wash thoroughly. 2. Pat aloe vera, sugar and also add water into the blender. 3. Mix and blend all ingredients until smooth. After everything is smooth, strain in first before pouring it into a glass. Non-medical treatment number 2, salvia leaves. Salvia leaf is a plant that belongs to the mint leaf family. Before being used as an HIV drug, this leaf was often used as an herbal medicament to treat viral infection. The benefits are not just a myth. According to research in the journal Letrophyology, salvia leaf extract is considered to have a great potential as a natural HIV drug. The result of the study conclude that salvia leaf are able to fight human immunodeficiency virus type 1, HIV1, which can cause AIDS. The study also looked at the abilities of salvia leaf to prevent the virus from entering and destroying. Salvia leaf is a plant that belongs to the mint leaf family that can be mixed with the drinks. HIV and AIDS prevention. Until now, there is no vaccine that can prevent HIV infection. However, HIV transmission can be prevented with the concept of ABCD, namely A. Abstinence. For those who are not married, that having sex outside of marriage is the most appropriate step to avoid exposure to HIV. B. Be faithful. Be mutually loyal to one sex partner. Avoid the behavior of multiple partners to minimize the possibility of HIV transmission. C. Condoms. Use a new condom every time you have sex, either vaginally or rectally. When choosing a lubricant condom, be sure to choose a water-based lubricant. Avoid condom with oil-based lubricant because they can lack condom. D. Drug no. Avoiding drug use, especially drug injection needles, can prevent a person from becoming infected with HIV. In addition, avoiding sharing needle can also prevent infection with the hepatitis B virus. E. Education, providing accurate information about HIV, the mode of transmission, prevention, and treatment can help prevent HIV transmission in the community. That's all we can say, and thank you.